Moving on to our next guest and speaker for today. He is Dr. Lenny Da Costa, is a consultant geriatrician, preventive cardiologist, an anti-aging and a functional medicine specialist, undergone training in practice of anti-aging and preventive cardiology. He is certified by the International Board of Clinical Metal Toxicology USA. He is currently the president of Society for Regenerative Aesthetic and Anti-Aging Medicine India, President of Indian Society for the Study of Metal Toxicology and Chelation Therapy, faculty at Functional and Metabolic Academy of India, and chairman at the Southwest Integrative Medicine Forum India. During the course of his practice, Dr. Lenny Da Costa has lectured in various conferences and teaching workshops, and we all know that his Goa workshops are so popular. On anti-aging therapies, the use of chelation, IV nutritional regenerative therapies, metal toxicology, preventive cardiology, BHRT in geriatric cases, IV therapies for diabetics as well. Teaching faculty, he has also been a teaching faculty for a number of national and international workshops for the doctors. He currently has a number of online workshops available on various subspecialties in functional medicine as well. He has been treating patients for last 20 years and has treated more than 28,000 patients suffering from IHD, CAD, diabetes mellitus, and other chronic degenerative disorders. His topic for today and his specialty as well is ways to reverse hypertension. Over to you, sir. Please go ahead.
Thank you, Karishma. Am I audible?
Yes, you're audible, sir.
Okay, can I share my screen?
Yes, please, sir.
So first, congratulations and well done to the two speakers who have just finished before me. A lot of good sharing, and a lot of that is going to overlap here. So it's helped me, and I hope you guys can remember what they have said as far as insulin resistance and the salt is concerned. So thank you to Dr. Thangadurai as well as Dr. Kohli for some awesome sessions. Is my
screen is visible? Can you please
visible? Yeah. 1 minute. I'll do that. Okay, I need to shut this.
Thank you so much. We can see it and you are audible as well.
All right, how much time do I have from now on?
Yes, 27 minutes as of now, and 3 minutes or 2 minutes will take for the questions as well.
All right, done. Thank you.
Thank you.
So, my dear friends, I'm talking about hypertension because that's something that we see very commonly today. The numbers that we see today are over 1.8 billion adults aged between 30 and 79 years worldwide that are suffering from this. More than 2/3 of them are living in low and middle income countries. This was supposed to be a disease of the rich, but it's seen more in the poor. And estimated 46% of adults with hypertension are not even aware that they have this condition. Less than half of the adults, that's 42% with hypertension, are probably diagnosed and treated. These are World Health Organization numbers, not my numbers. So we need to go with it. I think the actual numbers are much higher. Approximately 1 in 5 adults, that's 21% with hypertension, they have it under control. This particular condition is a major cause of premature death worldwide. And all of you know how difficult it is to manage it. More so, even if you say you're going to reverse it, then it becomes even more difficult. So the global target for non-communicable diseases is to reduce the prevalence of hypertension by 33% between 2010 and 2030. It doesn't look like it's happening because the numbers are just going up. So what are the risk factors? I mean, these things you can find in normal textbooks, but I just want to put them in proper perspective so that we understand from here, where do we go? So one is physical inactivity. The other one is being overweight or obese. Obviously, it's a subset of being physically inactive. Then you have unhealthy diets. You have consumption of tobacco and alcohol, which is part of the unhealthy diets. Poor sleep is another risk factor, which we don't tend to look at. High stress levels, just spoken of so much, but we really don't know what to do with it. And then you have the unmodifiable age, family history, and if you're suffering from any comorbid conditions like diabetes, kidney disease, etc., that also cause or have a hand in you suffering from hypertension. Is there any data to show the effect of any of the following on hypertension. And that's where we start with understanding how we can reverse hypertension. One is exercise routines. And so because of the shortage of time and the short time period that I have, I'm going to put the main takeaways that you can take away from this 20-25-minute session of mine. So let's look at it very specifically. Do exercise routines have an effect on hypertension? Do diets have an effect on hypertension? All of us tend to concentrate only on the diet. At the end of it, you'll understand why it's not just about the diet, but we need to look at them as well. Does sleep actually affect hypertension or cause you to have hypertension? Let's look if there is data on that in modern medicine. We're going to use all that data to understand how we can reverse hypertension then. And then you have stress, which is spoken of so often. And finally, toxins and how to go about detoxification, and if that has an effect on hypertension and reversal. Yeah. So let's first start with effects of exercise on hypertension. So this was something that I picked up. It was a paper that was published in Cardiology Clinics in 2001. It spoke of exercise as hypertension therapy. This was the title in itself. And so I picked up something that was important. It said, in conclusion, the findings of the most recent studies show that moderate intensity aerobic exercise training can lower BP in patients with stage 1 and stage 2 essential hypertension. Average reduction is about 10.5 millimeters of mercury for systolic and 7.6 for diastolic. Reductions do not appear to be gender or age specific, very important. And significant reductions in BP and left ventricular hypertrophy regression in patients with stage 3 hypertension have also been reported following aerobic exercise training. Of course, he goes on to talk about resistance training, which adds to the benefit. So this is one of the first papers in recent times, I mean, it's just 2 years old, that talks about exercise that can be used to treat hypertension. Again, another one which was published online in 2020. Again, it talks very similarly, but it says physical activity and exercise are shown to delay the development of hypertension. Both aerobic and resistant exercise have proven to reduce blood pressure effectively. And so it goes on to say that since brisk walking is easy, inexpensive, simple, and effective way of exercise, this type of aerobic workout can be recommended to society. Now, all professional organizations and government bodies should recommend this kind of exercise at least for 30 minutes and for at least 3 days a week. And it goes on to say that resistance exercise should be done on 2 to 3 days a week as well. This is something that came out in 2020. Again, an advice to manage hypertension. We are still not looking at reversal here. But yes, it does help you to ensure that your number of pills that you're taking do not go up year after year, that we see when patients come to us. A lot of this and my interest in hypertension comes from the fact, my dear friends, that I myself, prior to COVID, used to take 4 antihypertensives. And come what may, it wouldn't go down. So a large part of this presentation is my own story, and the same that I use for my patients since then to reverse their hypertension. It takes anywhere between 6 to 8 months, but it does happen. So at the end, I will tell you exactly what my protocol is, so you can take that away as a takeaway from this session. Now, this is another one that I looked at. Exercise intensity, whether the kind of exercise that you do, how does it affect you, or does it affect hypertension, and can it help in any way? And so this was something that I actually found, which was very interesting. If you can see my cursor, go to that part. It's compared with continuous moderate intensity aerobic exercise that the earlier paper spoke of. High intensity intermittent exercise typically results in greater aerobic fitness, increase in lesser time, and produces greater changes in arterial stiffness, endothelial function, insulin resistance, and mitochondrial biogenesis. One of the characteristics of high-intensity intermittent training is that it typically involves markedly lower training volumes compared to traditional aerobic and resistant exercise programs. making it time-efficient strategy to accrue adaptations and blood pressure benefits. This review brief, then it goes on to say what it does in this paper. So before I go on to the next slide, the reason why I put that out there for you is to understand that one of the major problems that we have when we tell our patients, you need to exercise daily, is people say we don't have time. And 90% of my patients who come to me, I only make them exercise 15 to 20 minutes a day, some of them even 10 minutes. And it has a major, major benefit. But how you do that exercise matters. And that's where I had put that paper for you to understand that high-intensity workouts do help in hypertension, and they have a better effect in hypertension. Does it do any harm? Well, there is a paper here, Exercise and Cardiovascular Risk in Patients with hypertension. And it goes on to show you that the merit of different exercise volumes, mainly high-intensity interval training and isometric resistance training, appear to have a strong cardiovascular protective effect. All right? And the next one, it says, despite lay and media perceptions, cardiovascular events associated with exercise are rare, and benefits of regular exercise far outweigh the risk. So it is safe for you to do exercise even if you have some kind of a cardiac condition, provided you talk to your doctor before you do it. And I hope the doctor understands what he has to tell you. This is another one in the British Journal of Sports Medicine, what kind of exercise works. And so it says, while both modes are efficacious, IET, that is interval training, appears to be a superior mode of exercise and management of resting BP, but high-intensity interval training may achieve wider physiological benefits with greater reductions in resting heart rate. Now, why is it so important? And let's understand a little bit about exercise. Why is it important to exercise and what kind of exercise? So if you understand the exercise physiology, you'll be able to tell your patients things a little better. So the body selects several fuel sources when it's exercising. It can burn fat, it can burn carbohydrates, it can break down protein. Now, when you exercise at different durations, at different levels of intensity, it alters the relative proportion of energy you derive from these three sources, right? For first couple of minutes, your body uses the ATP and it's over because the supply is very limited. So within 2 to 3 minutes, the body switches to carbs, and this lasts for 15 to 20 minutes before you switch to fat. Now, your body makes fuel choices depending on what is the activity that you're doing. For example, when you're resting, most of its fuel comes from fat. The low-intensity exercise, it picks it up from carbohydrates. Moderate intensity, it goes back to fat. And high intensity, it picks it up from carbs. Now, low-intensive activity, body derives most of its energy from carbohydrates and only 15% from fat. Now, this is what we used to do as hunter-gatherers in the prehistoric times. But when you step up to the activity of moderate, that we call, which we have been advising our patients to do, go for a 30-minute walk, go for a jog, or do a treadmill for 20 minutes, or whatever that is, that burns about, gets energy from fat. 55% of it is from fat. Now, that is why they say you want to burn fat, do this kind of exercise, but that could be wrong. Why? Because high-intensity activity derives most of it, it's 95% from carbohydrates. All of the high triglyceride stored fats come from unused carbs. Please remember this. So to get good fat loss, one needs to use up the carbs. You have to cut the source of fat, that is carbohydrates. And it is only high level of activity that has highest carbohydrate burn rate with low intensity, while the lowest intensity is the second highest use of carbohydrates. All right. So both forms of activity is what our ancient hunter-gatherers did to maintain their lean body. They used to either run for their lives or run for their food, or they used to walk gingerly for long periods of time. So short afterbursts or short bursts of exercise tell your body that the storing energy as fat is inefficient. Why? because you will never use that fat for exercise because you finish your exercise within 20 minutes. Carbohydrates, which are stored in muscle rather than fat, burn energy at higher rates. So exercising for short periods, what happens is that these carbs get burnt out, and then post that, for the next 24 hours, your fat stores are replenishing those carbs, especially glycogen, in the muscle. Now, these short bursts improve maximal cardiac outputs, promote development of quicker cardiac adjustments to changes in demand, reduces blood pressure post-exercise and maintains the same for 24 hours, helps you lose body fat with as little as 10 minutes of exercise per day, and achieves a higher peak stroke volume during overload. My dear friends, there are more. It improves cholesterol levels, provides anti-aging benefit by raising testosterone, helps you lose weight by burning much more fat after you stop exercising. And you will be able to get these benefits in much less time than what you need, but then what most people do, that is spend hours and hours in the gym. That was as far as exercise is concerned. And let me tell you, that is one of the major tools I use to reverse hypertension. That's why I spent more than half my time on exercise. Now, effects of sleep on blood pressure. Again, there is a nice paper which says that during sleep, there is a dipping of BP, but when you don't sleep or habitually, short sleep duration is associated with hypertension, especially during middle age. Insomnia with object short sleep duration is also associated with increased hypertension risk. Now, this is a chart that tells you that if you have any form of sleep deprivation, it will finally lead to hypertension. And this was published by the American Heart Association themselves. So what can I do to get better sleep? Follow a sleep routine, go to bed at the same time each night, get up at the same time each morning, including on weekends, do some physical activity during the day. A proper daily workout is, but nothing post 5 p.m. in the evening. Most important, last meal by 7:30 or 8 p.m. No blue screens or bright lights 2 hours before bedtime. No LED tubes, lights or tube lights in your bedroom. You can use the good old bulbs that we used to use. And the room should be cool and pitch dark as you go to bed, ideally around 10:30 to 11 p.m. Now, stress and hypertension is another area that we're looking at. How does stress help affect health? So during stressful situations, our bodies normally react releasing stress hormones, adrenaline and cortisol. This is basically what we used to do in the good old days, which the body survived those trying times. And this was called as the fight or flight response. This would make the heart beat faster, constrict blood vessels, so your blood pressure would go up. The constriction of blood vessels would raise the blood pressure, but this was only temporary, because when the stress level would end, you would normally go back, and so the pressure would not remain high all the time. Fight or flight was valuable for us to face imminent threat when we were either facing some wild animal or we were running for our food. However, modern world contains mainly many stressful conditions which keep this fight or flight continuous. We go to sleep in a continuous fight or flight mode. This causes chronic stress in our bodies, which results in increased blood pressure, increased blood sugar, shutting down of those systems that are not required for fight or flight mode, because a primitive brain still believes that you are in the good old or 70,000 years ago, where you needed to fight for your survival or run for your survival. So it shuts down those various modes. Specifically, it shuts down hypertension. It shuts down your thyroid. It shuts down your sex system. But it also causes diseases like hypertension, diabetes, and heart disease. And that is probably one of the reasons why chronic stress leads to these chronic conditions. So high blood pressure and stress have an intimate connection. Our body and brain maintain a two-way communication, and you need to do that. So when we endure emotional stress, our blood pressure rises. But at the same time, when we have elevated blood pressure, it also makes us feel stressed. So according to health surveys, patients with hypertension report more feelings of stress and anxiety than those without hypertension. In other words, hypertension increases stress and vice versa. So if one has high blood pressure, doing activities that can help manage stress and improve health can have a long-term difference in lowering the blood pressure. So how do we manage stress? Again, exercise is number one. Physical activity lowers stress and blood pressure. 3 to 5 days a week of swimming, biking, hiking, and rock climbing maintains an overall healthy blood pressure. Physical activity, my dear friends, is a natural stress buster. All right. All this has been published. Then you need to get plenty of sleep. Again, we have gone through this. So good sleep plays a vital role in reducing stress as well as benefits the overall health of the person. I use melatonin to cut the cortisol effect, so keep that in mind. Ashwagandha is another adaptogenic herb that reduces the cortisol effect. If it's too much of cortisol secretion, it brings it down. So it's a good tool to have in your bag. Magnesium supplement at bedtime also helps in stress management. Now, how do we manage stress? Besides this, you have yoga and meditation. This is something that our country has given to the rest of the world, and we don't use it much. So these techniques do lower systolic blood pressure, and there's a lot of data on it. One thing I need to tell you is about breathing techniques in yoga, which have been adapted in other places. They call it breath work, which has a huge benefit on stress. I give it to my patients because even though you do everything that you ask them to do, you are going to be in a day. I mean, shit happens during the day. So that's when you get stressed. How do you get out of it? You know how to breathe for short periods of time, and you cut the stress response. The other one is gratitude. Gratitude breaks the stress response, and I'll tell you how a little later that we do that. And the other one is laughter. You laugh a lot, it cuts your stress, all right? Effects of diet on blood pressure. I'm not going to speak too much on this because I don't have too much of time. Many people have spoken about diets. But again, the issue here is insulin signaling. So any food that you consume that causes insulin resistance can cause hypertension and can cause metabolic syndrome, all right? So clinical studies have shown about 50% of hypertensive individuals that have hyperinsulinemia or glucose intolerance, whereas 82% or 80% of the patients have type 2 diabetes have hypertension. So insulin resistance does cause hypertension. I will not get into this because I don't have much time. There was a whole session on insulin resistance done, but you need to understand that insulin resistance does lead to hypertension. I have put some mechanisms how it does that. So if you can get hold of this presentation or the recording, you probably can go through this. A note on salt. Again, I won't spend too much of your time here on salt because a beautiful lecture before me on salt. But what you need to understand is you can have, like Dr. Kohli said, you can have salt for taste. The way to ensure that you balance that out is important that you have potassium, high potassium foods. This could be spinach, broccoli, squash, avocados, papayas, and bananas. Not too much of the papayas and bananas, but you should have them on a regular basis. All my patients who have eggs in the morning for breakfast are asked, even if they're diabetic, to have one banana because it gives you a lot of potassium. So it balances the salt and potassium when you have egg in the morning, all right? All this has already been said, so I'm not going to repeat it. So the best salt that I prefer telling people, use your local sea salt or your Himalayan pink salt if you want to, but you ensure that you have adequate potassium-rich foods, all right? So the diets that you need to follow is eat a diet that is rich in fruits, vegetables, nuts, seeds, high in fiber, healthy fats, nutrients such as calcium, magnesium, and all important potassium. All of this must have been told to you over the last 3 days. Don't eat carbohydrates alone. Always eat them with protein and fat, and ensure that you cut grains, cut sugar, avoid carbs for breakfast. That's my request to you. Eat fat, only the good, healthy fat with fats, and clean, grass-fed or sustainably raised animal foods. You should include fat at each meal. That is something that we tell most of our patients. The best sources of fat are avocados, extra virgin olive oil, nuts, seeds, extra virgin coconut or butter or oil, organic full fat coconut milk, whole organic eggs, fatty fish, a grass-fed lamb, bison, or organic poultry. No trans fats or hydrogenated oils. That is something that's very important. So the one thing I tell my patients, don't buy oil from a supermarket. Please don't use it if you're buying from there. That is bad for you. Eat about 4 to 6 ounces of protein with each meal. So if you make a fist, that is the proportion size of protein that you need to take. Avoid all gluten and dairy, all right? And avoid all processed junk food. That is also what Dr. Kohli said so beautifully. Finally, we come to toxins and detox and hypertension. So we've already looked at the food system and diet and nutrition. That is one of the ways that you get chronic disease. But what you see in purple here are endocrine disruptors, air pollution, lead and other heavy metals, and some pesticides. All of them also cause a disruption of insulin signaling. And so when you're looking at endocrine disruptors, BPA, dioxin, PCBs, you avoid all plastic containers to avoid this kind of toxins. Avoid Teflon-coated pans and cookware, and eat organic or local vegetables and fruits. Heavy metals, we are looking at lead, cadmium, mercury, and arsenic. These are the ones that can cause you problems. There is data to show that lead causes hypertension, specifically when you have chronic lead exposure. This is another paper that tells you that blood lead is associated with myocardial infarction and stroke. So there are various mechanisms, each of them telling you that there is, which will cause hypertension. Each of them, I won't get into those details. These are studies to show you that have been published to show you that high blood lead levels are associated with both high systolic and diastolic blood pressure. But one thing I need you to understand, there are two important enzymes that lead deactivates: delta aminolevulinic acid dehydrogenase and glutathione reductase. This leads to a very specific marker going up. It increases serum homocysteine levels. One way to know whether your patient will respond to the lifestyle changes or you need to detoxify him. All right. So these are the lab investigations that you need to do. HSCRP, which is your marker for inflammation, your homocysteine, I like it under 10. Lipo-A max 30. Small dense LDL we don't do in this country. And fasting insulin, though somebody said earlier 2 to 4 is the ideal, I prefer, in some patients you can go up to 10. It has to be under 10 and nothing more. So the tips to remove toxins are many. One of them is avoid toxins, chlorinated water, processed foods, plastic water bottles, food containers, pesticides, gas fuels, medications. You can use seasonal bowel cleanses. Colon hydrotherapy is a great way to kind of detoxify yourself. Something that I commonly use is chelation and my FIR sauna. Chelation, high dose vitamin C, both help in detoxifying. And of course, you can use ozone therapy as well. So my protocol, my dear friends, before I end, I'm in the last minute. I tell my patients gratitude on waking up. This breaks the stress cycle. Post-toilet essentials, 20 minutes of HIIT. That's what you need to do after you go to the toilet. Follow it up with breakfast, high protein, fat, veggies, fruits, no grains. If coffee is consumed, add L-theanine 100 to 200 milligrams. Lunch should be low carb. Evening, 10 minutes of cycling or 20 minutes of brisk walk before 5 p.m. Dinner by 8 p.m. Blue screen shut by 8:30 p.m. Melatonin, magnesium, ashwagandha 1 hour before bedtime. Lights out by 10:30, 11. This is the routine I followed to drop down from 4 antihypertensives to 0. I take 0 at this point in time. If you do not follow this protocol, no detox helps you and will work effectively. My take-home message, my dear friends: hypertension is a lifestyle disorder. Change your lifestyle to get rid of hypertension. Revert back to the old lifestyle. It comes back with a vengeance. And this is something you need to know. Reversing hypertension, you need to make sure that you don't go back to your lifestyle. Otherwise, it will come back with a vengeance. There is no cure. To live with hypertension or get rid of it is in your hands, because you can change your lifestyle. No medication help in reversal. They give you temporary relief. Remember, when you put diesel in a petrol car, it stops working. When you get hypertension, it's your body telling you wrong fuel is going in. The body has started to shut down. My dear friends, that's my take-home message. If you want more, you can get my book, Is Your Doctor Keeping You Sick? It's available on Amazon and all the other online stores. Thank you for having me. And I think I overshot by a minute. Sorry, Karishma. I tried to make it under 30 minutes.
Very beautiful. Thank you, Dr. Lenny. It was very, very nice. And thanks for sharing your own personal protocol.
Pleasure, Doc. I don't know. I've not seen any questions, and I'm free to answer them if there's time.
Because your presentation was so good, sir, and such a wonderful presentation. There are no questions at all. Everybody has understood.
Or they didn't understand anything.
Yeah, as you say in all of your workshops, either some people understand or they don't understand at all. But I guess they have understood. And there's just one question, and throw some light on early cardiac arrest. But as you have summed up everything, what are the reasons of these days that there is an early cardiac arrest at a very early age? How would you sum up in 2 sentences?
So there are lots of things that are happening right now, but what probably the question is, why is it that when people exercise in gyms, they get a
gym and then yeah.
So the problem there is, and I hope this message goes out to anybody who's a gym instructor who's also listening to this. Guys, what you are telling them to do as high intensity interval training is not correct. You can't take the heart rate to that high. What we talk of high intensive interval training is short sprints and you cool down. Short sprints and you cool down. And it has to be adapted to the person's manner in which he can do it. You can't tell a 30-year-old who has not exercised before to do a 20-minute interval training. When we put people on interval training, we start them with 5 minutes, Karishma, and we do it very slowly. So the problem there is wrong advice for people to exercise, and that causes a whole lot of strain on patients. Besides that, yesterday I saw a patient who told me that he was exercising for 30 minutes and he's got cardiac failure. He's 32 years old. So I asked him, why were you exercising for 3 hours a day? So that's what my gym instructor told me. All right. So that kind of that's overdoing. So when you do anything which is beyond limit, you are going to harm yourself. And that's like truly asking for trouble.
Yeah. Throw some light on myths between the LDL and hypertension.
So first and foremost, high cholesterol or high LDL is not going to cause hypertension. So let's understand the concept. Low density lipoprotein is made in your liver. I mean, the cholesterol is made in your liver. It's transported by a transporter called LDL, which is basically taking it to the site where it needs to be used. It's only when LDL gets oxidized, and that's why I put the thing there, oxidized LDL. So you need to look at small dense LDL, which is oxidized. That causes intimal damage, or it causes damage within your arteries, the intima, which in turn leads to hypertension. Normal LDL doesn't, and you don't have to worry about it if you don't have small dense LDL which are high.
Thank you so much, sir. I guess all the questions have been answered. It was wonderful having you, and you have taken out, we know your busy schedule, but you have taken out the time especially for IAFMCON. Thank you so much.
Pleasure. And I'm sorry if I was delayed in sending you the stuff, but it was a pleasure being here, and I enjoyed it as much as you guys did having me. Thank you.
Thank you, Dr. Lenny.
Thank you so much. Thank you, sir.
Thank you.